So today we're going over some of my favorite foam rolling exercises for sciatica. When I use these with my patients, they really enjoy the way it makes them feel, and we're able to keep their sciatica nerve pain down. So a couple nuances to remember as we're going through this is, one, listen to me. You want to make sure that you're listening to the instructions and don't push past your nerve pain, but we are going to flirt with it. And two, and that you should not have lingering discomfort after we get done. These are relieving exercises, and so these foam rolling exercises should make you feel better and not feel worse. So you should notice a reduction in sciatica and or a loosening of the area, and that feels good as well. So before we get started, just remember those things. And then also, I am using a roll with it foam roller. I like this one because it's softer and it's a good length, but you can absolutely use a shorter one, but I do recommend finding a foam roller that is relatively softer because these are sensitive areas. So just remember those things as we're going through. Mine, I really enjoy using it, and my patients use a similar one. So we're gonna go into those exercises right now. So you're going to want to use your foam roller, and you're going to want to set it underneath the leg that we want to work. So for me, we're going to work our left leg here. Okay. So we're going to work that left leg. Now our first one here is we're going to hit the lateral thigh, or the outer thigh. This is a typical referral pattern for sciatica. Some people have it into the back or off to the side. So we're going to want to get the foam roller on the side, but remember your knee's here and here's a bone. We don't want to work that bone. We want to work this area right here. So I'm going to start off just above the knee. My other leg's going to be forward. Okay. I'm going to brace myself with my left hand in this example, and I'm going to work that area. Right there is sensitive for me. So if you find your sensitive area, work it up and down, mild pressure. Now I can't put my whole body weight into it. I'm putting a good amount of weight through my arm here because it's really sensitive here. The IT band, that muscle that we're on right now, or that tendon, is very close to the surface and it's sensitive. Okay, and now you're gonna see me roll into another area. This area is much less sensitive for me. I'm gonna roll into that. How long? About a minute on each of these. Ooh, you're gonna work into that. It's gonna be good for your upper body too. But remember, no increase in symptoms, and it should not be lingering. Find your areas of sensitivity and work on those areas. Ooh, it hurts so good, let me tell you. It's a little bit brutal too, so just handle what you can. This is the most sensitive exercise we do. That's the lateral thigh. Okay, off into here. Now we're going to work into the glute, in which the sciatic nerve exits after it comes out of your back. So you're going to get that foam roller right on your butt muscle. We're going to work the meat of the glute, and this one's much more tolerable. Oh, you're going to work from your butt bone to the top of your hip, right there. This one much more enjoyable. Remember, the sciatic nerve comes out right there. So don't be surprised if you have a little zinger down in your foot. Shouldn't be lingering, and honestly, a lot of people don't have it because of how much muscle is in the glute. Ooh, this one feels good. Foam rolling routine for your sciatic nerve is good. Good. Okay, glute, another minute here. So we're gonna work the outer glute right there. We're gonna work the meat itself down and back. This foam roller feels good. It's nice and soft. I enjoy using it. I used to have a bigger one, not a bigger one, the same size, but it's like styrofoam. Very challenging, hurt quite a bit. And I was like, there's gotta be a better way. Well, this one was better. Okay, now we're gonna work the hamstring. Remember the sciatic nerve, back, glute, then comes down the hamstring. So I'm gonna put my weight, remember hamstrings, knee to butt bone. So we're gonna work this area right here. Butt bone to knee. Oh yeah, feels amazing. This one feels really good. I can put quite a bit of weight into it, no problem. Ooh, I really enjoy doing this one. Now your hamstring, there's 4 different muscles there. So you can hit your inner hamstring, which is like in the inner part of your leg. And then you can hit outer hamstring, and I can turn my hip just to hit those 2 different areas. But you'll see me, I like to just find my area, work it for a couple seconds, roll down, work that new area for a couple seconds. Now, in areas that you have sensitivity, go ahead and work those areas a little longer. It's totally fine. It says this is not strengthening, so you could do these often and frequent. Wait, that's the exact same thing. You could do it often and more frequently than you think. Cool. Okay, we've worked outer thigh, we've worked glute, we've worked hammy. Now time for my favorite one. So you're gonna bend the other side, the other side that's not having discomfort. You're gonna put that foam roller basically at your calf, okay? Then you're gonna sit up tall, push those hands and sit up tall, right? This is as tall as I can get. And then you're gonna pull up those toes and point down those toes. Pull up and point down. Pull up and point down. Now, my patients who have sciatica, they feel it when they pull up and they feel relief when they point down. That's absolutely what should happen. 20 to 30 reps or another minute, whichever you prefer. For me, I like doing this routine if I set a timer on my phone or set a timer on an app, and just for it to beep every minute, and then I know to switch. Or you can do it during a commercial break. Doesn't matter. Pull up, point down. Pull up, point down. Pull up, point down. So we just went over 4 great exercises, some of my favorites to do. If you're wanting to level this one up a little bit, this is a little bonus, didn't necessarily intend to go over this, but that's okay. You're going to go into a more of a slouch position and then do the same thing. If you notice an increase in symptoms, that's normal. But again, you want to glide to that nerve. This nerve glide with a foam roller is really good. So our first one here, nice and tall, point up and point down, pull up, point down. Then you're going to do the same thing in a slouched posture, point down and pull up. I promise you, if you do these nerve glides, you're going to be moving that sciatic nerve. It's been proven to move during these exercises, and you should be feeling better. And what my patients report is after they do this, they either have a reduction in symptoms or this leg just feels better. They just feel looser overall. Let me know what you guys think. Did you have the same response? That'd be great to know. If you have any questions, please leave it in the comments and I'll get to them. But I appreciate you guys watching, enjoying that little foam roller routine that I use with my sciatica patients and that I've used on myself. As always, guys, I appreciate your time and just engaging, and stay healthy, keep moving, and take care of yourself.